The National Department of Health and its partners are conducting training on surveillance, clinical management, infection prevention control, trainings on WHO guidance, and risk communications for the coronavirus disease or COVID-19 pandemic. The Health Department, under the management of some most experienced and knowledgeable leaders like Acting Secretary Dr. Pearson Dakulala, two Deputy Health Secretaries Dr. B.F. Sibauk and Ms. Alva Lionel, and Health Emergency Incident Manager Dr. Downey Astrom, and Health Technical Officers with the support from the international partners like World Health Organization, UNICEF, United Nations, Department of Foreign Affairs and Trade, Australia, World Bank, are championing the spread of the deadly COVID-19 disease. Often, a team is out there defending the country against the enemy. In the eve of the coronavirus disease pandemic and state of the emergencies and control measures taken to safeguard the people, our health experts from the National Department of Health and World Health Organization are randomly executing the plans at different regions despite travel limits. An energetic team flew into Vanimo from Port Moresby to conduct training. Amidst all odds and busy schedules, health officers from the 5 districts in West Sepik have been waiting to take out the important training. They will go out and put whatever they learn in practice, doing specimen collections, surveillance, and awareness as captured in training. One of the most important components of the communication training was stigma, myth, and rumor busting.
I've seen on social media that the new coronavirus outbreak has provoked a lot of social stigma and discrimination. This is harmful to not only those who suffer from it, but for everyone. Stigma can isolate people. It can drive people to hide their illness to avoid discrimination, and can even prevent them from seeking medical care. So it is very important to avoid stigmatizing people.
The training is also to safeguard our health workers when handling the COVID-19 pandemic, and health workers will apply the knowledge learned while attending to their clients and patients. The facilitators include Dr. Matthias Barry, whose experience in emergencies, Jacob Marcos, Theresa Paula, and Sandra Wanatra.
We just finished the COVID-19 training, especially on surveillance, infection prevention and control, risk communication, and clinical management is very important for the province to develop the rapid response team in response to the COVID-19 pandemic.
It's the eye of the mountain below. Keep careful watch of my brother's souls. And should the sky be filled with fire and smoke, keep watching over during suns.
The 2-day training was formally opened by Dr. Stella Jimmy, Director, Curative Health Services, on behalf of the West Sepik Provincial Health Authority. Dr. Jimmy says that such training is a vital tool to combat the disease. She says health officers have been waiting to receive their training.
Disease that is happening on the other side of Papua province and the common land and sea border that we share with the Papua province of Indonesia. We are very much mindful of the threat, the very real threat of COVID-19 to the people of West Sepik province. At this current time, we now have the team from the department that is on the ground conducting training with all our health staff, with the specific health staff that we have selected from the district and from the hospital to attend this training on COVID-19. And we are very thankful that this training can be done at this time to prepare the staff, because that's one of the things that our staff have been fearful of, is about the disease itself. We'll be able to prepare the staff to handle this disease.
The participants were introduced to many activities, including pre and post tests, and further showed steps on how to do donning and doffing of PPEs. The practical part of it was of course much interesting, as it went well with the videos. The participants expressed satisfaction and embraced the skills gained.
Kind of appreciated this training, and at least we can say NDOH came got one training done after a long wait.
The West Sepik PHA also gave positive feedback to the trainers.
From our end is continue to provide that report, but also request for updates, request for advice. If you see something that could be done better, to update us, let us know, hey, this can be done a bit better. I think as long as we are communicating and dialoguing, I think we can go further. Anyway, I'm side doctor, but give us something, and we thank you for coming. Thank you all for coming and supporting us at this time. We appreciate this. Our team will continue to stay and discuss and try and develop a solid plan before they go back to the districts, but we appreciate all the work our department is doing, and we support our department as well.
The trainers were given a quick tour to the COVID-19 isolation center, the Vanimo General Hospital, and they also had time to visit other important facilities too. On Monday, the team traveled to Kiunga. The team will go back to Port Moresby with samples from West Sepik and Western Province. Kiunga and West Sepik provinces, their government is taking tough measures to prevent COVID from entering their provinces. In Kiunga, we also learned that they were doing their best to protect the people from the COVID-19. We also witnessed that their Not Fly MP on James Donald was also doing awareness regarding the state of emergency.
All movements of people crossing over 2 international borders remain restricted, and it must be observed accordingly.
The trip was made possible by the Fed or the government of Australia. The National Department of Health with its partners will continue to deliver until the COVID-19